This is the bowl right here, and then further up is the folding of the ear. Jabor with Cosmetic Surgery and Laser Center of El Paso. Today we are going to be performing an otoplasty. So I want to show you the key steps. So if you can see here, we have the patient. The patient's asleep. Important note is that usually I do these awake, under local anesthesia and just sedation in the office. But because we're doing other procedures, the patient is under general. But what I wanted to really show was the otoplasty. So when looking at the ears, people come in because they're upset because the ear is too far off the head. So there's usually two main causes for that. One is, if you can see here at this bowl, we call the conchal bowl, it's made of cartilage and it overgrows, so it pushes the ear out. So one of the key steps is I'm going to take a portion of that off and then put sutures so that it brings it back. You can see how that kind of even snaps right there. So that's really one of the main factors holding that ear farther from the head. The second is what we refer to as this anti-helical fold, or this fold of cartilage right here. So it's usually a combination of this and then this being recreated, and then those two bring the ear much closer to the head. So that is what we're going to do today. I usually I've done some marking, so all the incision is going to be on the back part of the ear, nothing on the front. I'm going to inject that. We'll get her cleaned and we'll get started soon. Patient is here, prepped, ready to go. Local anesthesia has been injected, so I'm going to go ahead and make that incision now. So this will be on the back portion of the ear. This is where I'm making my incision. And I'll go ahead and complete that, and I'll take that strip of skin off, and then I'll show you as we start getting into the procedure. So I made the incision. We have these skin flaps elevated. So this is the cartilage on the back portion of the ear. This is the bowl right here, and then further up is the folding of the ear, or the anti-helical fold that we want to get access to. So I have all the access I need. I'm going to start doing some markings. We'll remove a segment of cartilage here, and I'll put sutures in for the to recreate that anti-helical fold. Okay, so I've done my markings. This ellipse right here, if you can appreciate, that's the cartilage I'm going to remove, and then I've marked some other spots here where I'm going to put in sutures. So we'll get busy, and I'm going to remove this portion of cartilage. And you may think, well, if you do that, that's going to distort how the ear looks. When you remove it in the bowl, it really doesn't do much except for bring the ear closer back to the skull, which is what we want to do. In fact, in revision rhinoplasties, this is an area where we can harvest cartilage to use for the nose, and it has very little changes on the ear except for bringing it a little closer to the head. Okay, so I went ahead and made that incision. Here's the piece of cartilage that I removed. Okay, so there it is. Again, we could use that if we were doing a revision rhinoplasty. That could come in handy, but that's not what we're doing. So you can see here, what you got that out, it still wants to spring forward, but you can't appreciate this with the video, but the resistance I'm having to put here now to bring this back is minimal. So I'm going to put some sutures spanning that so it closes that defect. I'm going to put other sutures that are going to go from here back over to the back portion here. It's going to pull the ear back, and then the last ones are going to be those sutures that are going to recreate the anti-helical fold. So I have all the sutures in place, and now we're ready to start tying. So I'll tie this first one here. Okay. Then I'll have my assistant with their finger just sort of hold that down. So as I'm tying it, it doesn't come displaced. All right, you come off there. As you can see, what we've already done, see how it's coming down here. With each progressive suture, it's going to start coming back more and more, and we're going to have an ear that's much closer to the skull. Sutures have been put in place. Now look what we have here. Now this ear, I'm not having to, we've broken the spring, and then we put the sutures to recreate this fold. So now it's set back good. You can overdo it as well, and you can make the ear look like it's just attached to the skull with no sulcus or no space, and we don't want to do that either. And the other thing you want to do is you want to have the external part of the ear still look like what it did previously. so it looks natural. So, you know, I think we've accomplished all those. There's a lot of swelling here, so it's sort of taking away some of the definition, but I'm overall happy with that. So all I need to do now is irrigate and close that incision, and we'll move on to the left ear. Okay, so I'm all done with the otoplasty. Ear is already getting a little bit bruised, you know, no problem. Everything went well. You can see how, you know, much farther back it is to the skull, and then it's closed back here. You can see we have a suture, and we use absorbable sutures. We don't have to take those out because it's a little difficult to get out. You gotta kind of peel the ear back, and that's painful right after surgery. So no sutures will need to be removed. The exact same thing was done on the left side. I just didn't show that, but we'll put a dressing on her, and that essentially completes the otoplasty. I'm Dr. Mark Jabor, Cosmetic Surgery Laser Center of El Paso. If you like what you see, please give me a thumbs up. If you want to become a subscriber, you can see all the latest content.